All right, class, let's go ahead and jump right back into our lecture. We're going to start back off with drug dosage. So the dosage is the amount of medicine that is prescribed for administration. So this is how much or the amount that we're going to be giving the patient. It's determined by the provider or the qualified practitioner who considers the following factors. So most drugs are suitable for patients aged 16 to 60. Patients outside of this age range, other things need to be considered before picking a specific dosage. But for our bigger population between 16 and 60, most drugs are going to be suitable at a certain dosage amount. Same goes for weight. The average adult dosage is based on approximately 150 pounds or 68 kilograms. People who weigh less or more than this should have the dosage based on a body surface area or kilograms of body weight. So if a patient is much smaller or much larger, the physician may adjust the dosage based on their weight. Sex also needs to be considered. Many medications are contraindicated during pregnancy and breastfeeding, and it's important to know these factors before any dose is prescribed by the provider. Other factors may be considered when prescribing an amount or a dosage. Physical and emotional condition of the patient may be considered. Any other disease processes that the patient may be experiencing, especially kidney disease or liver disease. The kidneys are often the organ that breaks down or metabolizes the drug, and so if they're already in kidney failure, we don't want to put any more strain on that patient's kidneys. Other comorbidities or other disease processes going on, we need to make sure that these medications aren't going to be contraindicated in those circumstances. We also need to know the patient's medical history and their allergies. Obviously, you need to make sure they're not allergic to it. And then know the safest method, route, time, and amount to affect the desired maximum results. So all of these things will be taken into consideration when that provider comes up with that drug dosage or the amount of the medication to be prescribed to the patient. So as we kind of already mentioned, for our patients that are less than 16, we're going to have to consider a different way to understand the amount or the dosage for those patients. So pediatric patients are children under the age of 16. And pharmacokinetics dictates that drugs must be administered in smaller, more frequent doses to children. So these dosages are weight-based and are often given in milligrams, milliequivalents, or micrograms per kilogram. So they're based on that weight. Their dosage is based on how much they weigh. And this allows for much safer drug administration. And we'll talk a little bit more about this when we start actually calculating drug dosages and drug amounts for patients. Okay, so we've talked about the prescription, we've talked about the medication order. Let's switch over to the medication label. This is the label that's actually on that medication. So we have our trade name or our brand name on the medication. We have the generic name or the listing of the active and inactive ingredients. The national drug code numbers that can be used to identify the manufacturer, the product, and the size of the container. The dosage strength in a given amount of medication. The route of the administration. Any precautions or warnings. And the expiration date for the medication. So all of you have seen a medication bottle before, and you've probably noticed these different things on there. You may or may not have known what each of those things were. So we're going to kind of break it down and talk about these with an example. So here's our example. We have our pharmacy name and address there at the top, so we know where it's coming from. The pharmacy's telephone number, so we know where to reach that pharmacist or that pharmacy. We have our doctor's name. That's the doctor that prescribed this drug. There's a number used to identify the drug, and you can see it there in that yellow box right here. We have our patient's name, very important, our patient's name and their address. We have our instructions. So here it says take 1 capsule by mouth 3 times daily for 10 days until all taken. So this patient's going to be taking 1 capsule 3 times a day for 10 days and make sure they're all gone. And the drug that they're actually taking is called amoxicillin. This is the name of the drug. It's in 500 milligram capsules. And below here, we can see if there's any other kind of qualifying information. So here we would have the number of refills. For this particular drug, we do not need refills. And just for those of you that are curious, amoxicillin is a very common antibiotic. And so the patient has never used, this tells us when to use this by. So we want to make sure that this is kind of the shelf life. So we want to make sure that the patient uses this drug before this date. And then after that date, they need to throw it on out. So that is all of the information found on the drug label. I do want to backtrack just a second. I realized I didn't kind of differentiate the two here on the medication label. So I just want to throw this out there that oftentimes there is a trade or a brand name, but also a generic name. So I'm going to give you a very common example for you to kind of think of this. So the drug Tylenol. Tylenol is the trade or the brand name. Its generic name is actually acetaminophen. So you can buy just generic acetaminophen and you're getting basically the same thing as that trade or brand name Tylenol. So I just want to throw that out there on the medication label that sometimes you'll see two names and one is usually the brand or trade name and the other is the generic name. Okay. Moving on, we are going to talk about how we actually calculate those medication dosages. So we talked about how the provider calculates how much they want to give the patient, but we also need to be able to kind of calculate how much we're giving out of that medication vial or bottle or however it is dispensed. And this is going to be when we're actually in the clinic setting. So the preparation and administration of medications is one of the most critical tasks that the MA performs. Incorrectly calculating or measuring dosages are the leading cause of error in the administration of medications. It's important that the MA develop a working knowledge of mathematics to calculate a medication that is to be administered to a patient. So in the clinic, we may just have a medication order from the provider and then have a medication cabinet where we have to go and find that medication and administer it properly at the proper medication amount or dosage. So this is where we would perhaps need some math skills to find out exactly how much we're giving that patient. And we're going to go through this and we even have a worksheet, so don't worry, we'll get through it, okay? So just to clarify, some different types of weights and measurements that you may see as we begin doing some of these mathematic problems or medication dosage problems. So two systems of measurement are used in pharmacology to calculate the dosage, and that's metric or household. The metric system is used throughout the world as the official language of communication in science and technical fields. So here, length is in meters, volume is in liters, and grams is going to indicate mass or weight. So for us, the most important is really going to be those liters, that volume, and the grams of mass. So we'll often see milligrams, milliliters, those types of things to tell us how much our medication dosage might be. Household measurements are approximate measurements and used more frequently in the home than in the medical field. It's also important to know these in the clinical setting because this is what our patient may be using at home. So like Tylenol, especially in children, ibuprofen, Motrin, those kinds of things. They may be taking even NyQuil, those kinds of things, maybe taking them in teaspoons, tablespoons, or ounces. So it's important to kind of be familiar with that system as well. So calculating adult dosages. Two measures, our weight and our volume, so we already talked about that. That's going to be our grams and our liters, are important to determine the amount of medication that is to be administered. The weight may be expressed as milliequivalents, micrograms, milligrams, grams, or units. So that's our weight. Volume may be expressed as milliliters. This M actually stands for a minimum, Not very common. Don't worry about that, but it stands for a minim. And for those of you that are taking notes, it's spelled M-I-N-I-M. This DR stands for drams, also not very common. And then ounces. Ounces is more used commonly. And then also a variety of household measurements indicates our volume, so teaspoons, tablespoons, those kinds of things. All right, so let's talk through an example of all these things, all these different learning points that we just went through. So here's our provider. He gave us an order for 250 milligrams of cephalexin, PO or by mouth now. Okay, so that's our order by the provider. That's our medication order. So we go and we find a bottle of cephalexin in the drug cabinet, and it holds capsules that contain 250 milligrams. So how many capsules will we provide the patient? In this instance, we're just going to provide the patient one capsule, right? So the order was for 250 milligrams, and our capsules that we found have 250 milligrams, so we're going to give that patient one capsule. Okay, so this next example is a little bit different. The provider orders 0.2 grams of Equinol tabs. The dose on hand is 400 milligram tablets. So we need to have the medication ordered and the one on hand in the same unit of measurement, right? So that way we can compare the two and know how much we're giving the patient. So 0.2 grams needs to be converted into milligrams. So converting that, grams, there's 1,000 milligrams in a gram. So we move that decimal point over 2 times to the right. That's going to give us 200 milligrams of Equinol tabs. So the provider wants 200 milligrams. The dose on hand is 400 milligrams. So what do? In that instance, we need to give the patient half a tablet. Do you see what that means? The provider wants 200 milligrams and we have 400 milligrams. So we have to divide that tablet so that patient is only getting 200 milligrams in that drug. So same goes for calculating children's dosages. However, remember what we talked about, children have to have their weight considered because they're all different weights and different sizes. So 2 basic methods used to calculate children's dosages. We do it according to kilograms of body weight. This is generally the method of choice and it's often easier to calculate. Just a point of reference, remember that 2.2 pounds is 1 kilogram, okay, because we're going to be using kilograms to calculate. And then there is a different type of way to calculate children's dosages. It's called body surface area, and this is an exact method, but a formula is needed and a nomogram, and it's much more complicated. So providers often use just the kilograms of body weight to get a specific dosage amount. So let's look at an example very quickly. The provider orders valproic acid 15 milligrams per kilogram per day capsules to be given to Sally, who weighs 110 pounds. The medication is to be given in 3 divided doses, or TID. So in this case, our first step is to convert our pounds to kilograms. So she's 110 pounds, and we need kilograms. So what we're going to do is take that 110 pounds, divide by 2.2. So that gives us how many kilograms? Right, 50 kilograms. So then we calculate the dosage per day. So 15 milligrams times 50 kilograms is 750 milligrams per day, right? So that's per day, but the doctor wants it to be given in 3 different doses per day. So then we take 750 divided by 3, so 750 milligrams divided by 3 times per day, which gives us 250 milligrams 3 times a day. So each dose is going to be 250 milligrams. All right, we're going to stop right here, and we're going to pick this up in just a second on our 3rd video.